Hey guys, so I just got off the phone with UPS. I've been waiting for like a week for this package, and it has a bunch of stuff that I need for the move, like packing tape and, things that I need. And they just didn't deliver it. They said that they came out and tried, and then they just took it to the facility like an hour away and said, you have to come pick it up. I'm like, why? What? Why? I've had 2 other packages delivered this week from the same company. I don't understand. They were very helpful, and they're trying to send it to me. At first, they were trying to charge me $16 to send it back to me. I'm like, I didn't do anything wrong. No, I'm not going to pay for that. Anyway, I wanted to talk to you guys today about doctors. Bless their hearts. What a noble profession where you have to deal with people at their worst. I wanted to tell you, I've gone to lots and lots of doctors in my life. I have gone to many, many, many specialists. I have seen new doctors numerous times for new problems that came up. When I go to see a new doctor, I like to ask a question before the doctor comes in, and this happened yesterday, and they looked at me like I was crazy. So I want to know if I'm crazy. I'm sure I probably am, but I like to ask the assistants. I said, okay, well, for a first exam with a new doctor, I like to ask, would they like to know the history before the exam, or would they like to do an exam before they know the history? Because in my opinion, it teaches me a lot about how the doctor's going to approach my problem. I have never come across a doctor that wants to exam before they get the history. And I understand why. I understand that you need to know the background, and you're just getting this stranger into your office, and all you have is the chart that's in front of you, and that patients can spout off a lot of crap that doesn't have to do with anything that they're there for. I don't feel like I'm one of those patients. I feel like I spend the hour drive to this new specialist thinking about, what do I need to bring up? What's important for them to know? How can this specific doctor help me with these specific problems? Because doctors are highly specialized, because most symptoms can mean a lot of different things. Doctors are detectives. They get you in their office and you tell them a bunch of symptoms or a bunch of problems, and they're supposed to figure out what's wrong. A lot of times it's only tests that they can go off of. Blood work, exams, looking at you in your ears and your eyes and your throat and all of those things. But I found it highly interesting that yesterday the specialist that I went to, which is my thyroid doctor, didn't even touch me. He didn't look at anything physically. All he did was look at my chart and ask me a couple of questions. And I spent most of the time sitting there in silence. I'm still very uneasy about it, and I don't know how I feel about that situation. I feel like once he finally started talking to me, and once he had gone through this massive chart that just has to do with thyroid, and not all of the other problems, he asked me a couple of little questions. He asked me if I had some questions. I said, number 1, does caffeine affect your thyroid? And he says, as long as you're taking your thyroid medication on an empty stomach first thing in the morning, and you do not eat for a half hour, you should be fine on caffeine. As long as it's after about a half hour after you take your thyroid hormone. I use just a plain caffeine supplement for my ADHD. So that's why I asked about that. I had my dentist ask me about putting fluoride on your teeth, because fluoride can affect your thyroid. And after throwing up for 6 months and being so sick with my gallbladder and digestion issues, they wanted to know, can they put fluoride on my teeth? Is it going to make my thyroid worse? He said, it's fine. You can have fluoride put on your teeth as long as it's done once a year. I asked him, is a goiter different than your thyroid gland? He says, no, they are the same thing. If I was going to remove a goiter, I would be removing the entire thyroid gland and all of the tissue that is connected to it. So he answered all my questions. He seemed very knowledgeable, but not once did he get out a stethoscope or an otoscope or a sigmodometer blood pressure cuff. And I know a lot of those things are done by the assistants, but the assistant didn't do anything except for check my weight, my temperature, and my blood pressure. So here's my point. My point is, if I was a doctor a specialist particularly, and you were coming into my office with a problem, I would not look at the history first. The reason is you can be highly influenced by what other doctors have done. And I think that what other doctors have done before you came to see the specialist, which for example is me, I would want all of that information, but first I would want to walk in the room and look at my patient, because when you're dealing with something like an autoimmune disease, you are going to have some kind of signs on the outside. Either they are going to look sick, and honestly, thyroid, you can have sunken in eyes or you can have bulging eyes, and those two different symptoms alone that I could walk into a room and see immediately are going to give me a direction to go without looking at any kind of history. Because if you have puffy under your eyes but your eyes are not bulging, if your eyes are kind of bulgy, that leads to a overstimulation of thyroid. That's hyperthyroidism. If you have a puffy face and puffy under your eyes, but your eyes are a little sunken and you look more like me, and you can see the thyroid issue going on as soon as you look in the room, you immediately go to, oh, this is a hypothyroid issue. So first impressions of a patient are huge in my opinion, because patients lie. Even great patients lie because they don't remember everything, and they say they have a fabulous diet, but they might not. I mean, I am one who has a great diet, but why would they believe me? I love first impressions when it comes to medical issues because you can tell a lot from looking at a person. Then I would go back once I have an initial, okay, I've got the information of what's right in front of me without being influenced by any of the past blood work, diagnosis, tests, or any of those things. Now that I've examined you and know for sure that you have a goiter and an enlarged thyroid and your face is not looking like hyperthyroid, it looks like hypothyroid, I would move forward with my questions at that point. But I'm an examiner first, because then I don't want to be influenced by any of the past. Once I have my initial impression, then I bring in the past, then I ask the questions, then I do all those things. I think that most doctors do it the opposite. I think that most doctors come in and say, what's the problem? Patients spout off a bunch of crap, and then the doctors already have all of these different things going on in their head. So then they're influenced by what the patient says, and then they look at the test results that their assistants or nurses just took, which are blood pressure, temperature, maybe a strep test or a flu test or something. All of those things are influenced. I think that the exam should come first. So that's my opinion. And that's a way to tell if you are going to understand the way your doctor approaches things. Ask them that before you get started. How do they approach new patients?